Okay, let's see if I can get this done in a hurry. Cephalosporins, they're cell wall agents. They were discovered in 1945 in Italy. We use them for cystitis, skin and soft tissue infections, bovine mastitis, as well as shipping fever. They're metabolized in the liver and excreted through the kidney. There are 4 generations of cephalosporins, and you can tell if it's a cephalosporin usually by either CEFH, which are older generations of cephalosporins, and CEF, which are newer generations of cephalosporins. And generally, as the generation increases, the spectrum of action broadens. So but they do become less effective against gram-positive. They are beta-lactamase sensitive as well as cephalosporinase sensitive. So the first generation of cephalosporins, cephalexin, this is one you're going to see in clinics. It's given orally. It has a narrow to broad spectrum of activity. There really aren't any side effects, though you do need to be cautious with animals that have renal failure. And the nice thing about this is the clients can give with food. Some other client education, finish this drug. Cephadroxil, also called Cephadrops, okay? It's oral. They come in tablets as well as suspensions. Their spectrum of action is negative, gram-positive. Their sensitivity, especially if they're allergic to penicillin, and again, caution with renal patients. The suspension, the owners want to keep refrigerated. They need to shake well before using it and then dispose of after 14 days. Cephazolin is an injectable generally used for pre, post, and during interoperations for infections, especially if it's like an animal that has had a broken bone or something like that. It is a narrow spectrum of activity. Be aware that there is pain at the injection site if you give it IM, so it does sting. If you are giving it IV, you need to give it slow. It can cause seizures. It can also cause vomiting. So be careful when using cephazolin. And it is reconstituted. Please make sure you put all the information on the bottle as well as put it in the refrigerator once you have reconstituted it. The second generation cephalosporins, cefotoxin, this is not really a true cephalosporin, but it is still kind of in that class. It has a narrow spectrum of activity, mainly gram-positive, hypersensitivity. You need to make adjustments if the patient's got some renal issues. Third generation, by the way, I want to go back up to second for a second, not used a lot in small animal medicine. Third generation ceftriaxone, they use this to treat borreliosis, which is Lyme disease. Hint, hint, you may want to remember this drug. You may want to remember this word. Spectrum of activity, it's broad, same type of hypersensitivity, worrying about renal function with this drug. Cephalosporin, this is used for large animal that have shipping pneumonia. It has a broad spectrum of activity. It does have some hypersensitivity. Please be aware there are withdrawal times that cattle owners as well as other large animal owners need to know about. It can be painful at the injection site when you give it IM, and it needs to be refrigerated after you reconstitute it. Another third generation drug is called cefopoxamine. This is also called Simple Ceph. It is a narrow spectrum of activity. It works with gram-negative, okay? Its hypersensitivity is what you need to worry about for side effects. The nice thing about this is the owners can give it with food. They do need to complete the treatment, but it is once a day dosing, so usually once a day is a little easier for owners. There's a new product, Cephofesin, which is also called Caniva. It is injectable, and the nice thing about this drug is it lasts for 7 days. So you give an injection, it's good for 7 days. If the infection hasn't cleared up in that 7 days, they can come for another shot, and that shot is good for another 7 days. It is broad spectrum. Do not use this in pocket pets, especially rabbits, guinea pigs, hamsters. So if they're herbivore pocket pets, you don't want to use this. It can remain in the body up to 2 months, so clients do need to know this. When you give it to them, can only give 2 injections, so only 14 days of dosing. Then the last one we're going to talk about is a 4th generation. This is a last resort drug. We only use the 4th generation cephalosporins if we really have to. And this is cefepime. It's broad spectrum. You need to give it the IV injection slow over about 3 to 5 minutes. It can cause seizuring. If you give it IM, you need to make sure you're giving it in a large muscle mass.